So the overwhelming majority of patients who have migraine start at the primary care doctor or the internist, and it's, again, as they become more disenfranchised from the treatment, they move on to the general neurologist. And I personally, I think that this is a field that we should own. This is a neurologic disease. So patients with migraine should be sent to the neurologist. I think any of us can treat migraine. It should be the bread and butter of general neurology. A headache expert, a headache centers like ours should be used for those patients who the standard drugs aren't working, or they have such complicated histories and comorbidities that it's just difficult to figure out a treatment option. But it should be the bread and butter for all of us in neurology. There are a number of misconceptions about the treatment of migraine. One is there's this don't ask, don't tell policy that many clinicians use, where they don't seem to understand how disabling the disorder is, and they just write a simple prescription or tell some of the patients to use an over-the-counter medication. Another aspect is that migraine is highly associated with nausea and vomiting, and all too often the physician doesn't ask about that. And clearly, if a patient has nausea, or more likely if they're vomiting, a prescription for an oral medication just isn't going to cut it. And you need to explore non-oral medication routes when that occurs. So we are now, we meaning the American Headache Society, I'm the current president of the American Headache Society, and we're having this push to, if you will, medicalize migraine, to take headache out of migraine. Because of the misperception, it's just a headache. Just have you tried your over-the-counter medication? Have you tried, maybe you're just stressed. Why don't you have some water and lie down for a while? And it's not, it's a true neurologic disease with valid biological basis, and now hopefully even better treatments coming down the pike. I spend a lot of my days not only counseling my patient, but having them bring in their family members. All too often it's the husband sitting with their arms crossed and basically accusing his wife of she just doesn't want to take care of the kids, or she doesn't want to clean the house, or whatever. And that should be outdated. We've spent so many years trying to educate the public, but it's amazing how it's hanging on. But we're in the process of coming out with a patient awareness campaign, not only for the patient but for the family members. Migraine doesn't just affect the person with migraine. It affects their kids, their spouses, their family members, their coworkers, because when you're down in bed with a migraine, everybody's suffering. Actually, it is worse than those other conditions in that it's more common and more disabling. It's according to the World Health Organization, migraine is the fourth most disabling disorder on the planet. In the United States, it affects about 38 million Americans. It affects over 1 billion people worldwide. So the thinking about migraine has sort of changed over the last few years. Instead of looking at it as an episodic disorder that comes and goes and runs its course, it is now looked at as a chronic condition with an episodic occurrence, like asthma, like epilepsy. And so if you're a migraine sufferer, you're always a migraine sufferer, although you don't always have the attack, but you're always vulnerable to have the attacks.